Today we're going to do a war room centered around the coronavirus because it's such a hot topic right now. I'm Chris Martin. We have Janelle Case and we have Jess Tamris with us as well. Right now we have a lot of our clients asking us how to respond to the coronavirus because it's such an emerging issue right now, and we have had multiple meetings with them to try to figure out best practices. And so we put together this special war room session for you today to share our best practices, where the coronavirus outbreak is at right now, and also some of the ways in which we're helping our current clients, but also could help you as this situation continues to evolve. So this is going to be a quick podcast, but we think there's going to be some really relevant information. Just to let you know, this is sponsored today by Compliance Live. Thank you guys very much for the use of your space. And so we are, just in case you don't know, ComplianceLine is the leading provider for hotline services in the healthcare industry. We also span a lot of different industries, so we're doing business with quite a few government, education, finance, but especially healthcare companies such as Banner, Genesis, Common Spirit, Henry Ford, Maxim, Kindred, CenturyLink, and the list goes on. So Jess, do you want to give us a little bit of background about how this situation has developed and sort of where we're at now with the COVID-19 virus?
Absolutely. So the CDC is responding to an outbreak right now of a respiratory disease that was caused by a novel and new coronavirus that was first detected in China, which has been detected in more than 100 locations internationally, including the U.S. as we speak. Of course, the coronavirus, aka COVID-19. Just recently, breaking news about 30 minutes ago, the World Health Organization has now declared the coronavirus outbreak a pandemic. Which means there's been 100,000 cases confirmed across the globe. Italy has placed their entire country under quarantine, and events in the U.S. such as St. Patrick's Day parades have all been canceled. I know that we have lots of universities that are canceling classes, that are now putting their classes online for the rest of the spring semester in many cases.
Wow.
It has been reported that there are over 4,300 deaths worldwide. And as of right now, there's over 1,000 cases in the U.S. and 31 deaths.
Wow. That's
Spreading
quick.
quickly. Yeah.
And I think it started in the U.S. on January 26th. As of about noon today, we have about 18 states that have declared emergency. It's growing as we speak. They could be declaring it right now. But just to throw a list out there, California, New Jersey, Florida, Maryland, Hawaii, Illinois, Indiana, Kentucky, Utah, New York, Oregon, Ohio, Washington State, Massachusetts, West Virginia, North Carolina, Colorado, and Michigan have all declared an emergency due to the coronavirus.
And with the way this is spreading, it's probably safe to say it's just a matter of time before the rest of the 50, all declared emergencies as well.
Absolutely. I would be shocked if we didn't have a few more that happened today, and I think by the end of the week it'll probably be all 50 states.
If you look at it, just 3 declared last night.
Yeah. So.
Yeah. So needless to say, this is a topic that's top of mind for a lot of the organizations that we work with, but a lot of the state and local governments as well, their reaction and their response and the methods that they use to manage some of this. So one thing that we're doing right now is actually setting up hotlines so that people can report issues or cases that they think might be related to the COVID-19 virus. We're seeing in the news right now, even in, up in Washington State, where people were being put on hold for 40 minutes and then ultimately being denied testing for COVID. So our clients have said, hey, there's got to be a better way. What can we do here? So one of the things that we're doing for them is actually setting up a hotline specifically for reporting potential cases of COVID-19. We are providing a 24/7 hotline for doing this types of reporting, where we are live answering the phone, not using any waiting rooms or call queues, so that people feel like they're truly cared about and get addressed at their time of calling. We're doing that initial stage of triage on those reports that come in to determine if they are in fact COVID-19 possible cases or if they're related to some other type of sickness. So some of the questions that we're actually asking to determine this are, one, do you have a respiratory symptom such as a cough, right? So COVID-19 is a respiratory disease, so
right.
A cough obviously could be related to other types of diseases, but that's one of the first things that if we can confirm that it's on the path of saying yes, this is one of the symptoms. One of the next things we ask is, do you have a fever? again, fevers can be caused by all kinds of sickness, but almost always, if you've got the COVID virus, you're going to have a fever of 100.4 or over, typically, right? And running that fever continuously. Another thing that we ask is, are you having any sort of problems with breathing or shortness of breath? Obviously, if you've got that issue for any reason whatsoever, go see a doctor.
Right.
But that is going to be one of the ultimate deciding factors of, if we can say yes to these 3 types of questions, it's a high likelihood that you've contracted the virus. One other thing that we're asking on the phone as well is if the reporter has a sore throat or a runny nose. Now, because the coronavirus is a respiratory infection, but it does not typically cause a sore throat or a runny nose. So if they say yes to that particular question, it means they may have some other respiratory infection, such as the common cold or the flu. So it's in times like this that we're sort of digging a little bit, asking these good follow-up questions to determine whether or not that person really needs to take the next steps of not only reporting it to their state health organization, but also taking that step of going to a doctor and getting tested for the COVID virus. So
We have the capabilities to make sure that we can be here, that we're still making those calls, and that's not going to disrupt our business at all. To take it even a step further, I mean, you want the right organization, the right compliance provider, hotline provider to be able to provide this service, because ultimately these are your citizens that you're in charge of. You were voted in office by these people, and they expect you to protect them.
Yeah.
And so finding the right way to get the information, to get them those tests for the coronavirus is extremely important.
yeah, that's a great point, Jess.
When people are calling in, you have to imagine they're scared.
Yeah.
Because of just everything they're hearing in the news and just from friends and family. So we have people here that are trained, skilled. They're going to show empathy. They know how to handle these calls. So you want to make sure, again, that you have a hotline provider that knows how to handle difficult calls.
Yeah.
And don't we have the longest in the industry, the longest tenure of our risk specialists?
We do, yeah. I mean, both of you, those are excellent points. I mean, look, at the end of the day, you need an organization that's going to care about the caller and make them feel like that they're being taken care of appropriately. And that's just as important as actually getting in the appropriate information to report it up to at a state level or to the health organization. So,
Yeah.
and of course, you just want somebody that's going to be reliable, that's going to be there for you. So those are both great points, and probably one of the things that we get complimented on the most by our clients here at ComplianceLine. So,
And I think it's just important to note, again, that even if this gets into our organization, we have the guidelines and process, we have the procedures and process to make sure that we can still handle the calls, that we're still taking the calls, and that there is no disruption in your service.
yeah. You guys did a little bit of research on other ways the hotline's being utilized right now, based on other factors that the coronavirus is causing. Do you want to tell us a little bit more about that?
Yes. So I'm sure you all have seen where you go out and soaps, alcohol,
Hand
Just
sanitizer,
hand sanitizer.
toilet paper.
the pricing is outrageous. The other day we saw something, hand sanitizer that was $10. Normally it's what, $2-3?
For a small bottle.
We are seeing companies use the hotline or counties use the hotline to report price gouging. It's happening out there. It's unfortunate, but this is a way for it to be prevented and it to be reported and taken care of.
I'm always amazed at the different ways that people utilize the hotline for the various issues that pop up. But the great thing about what we do is it's so flexible. You really can utilize it to gather that information in, because it's only then, when you're aware, that you can take action on it.
Right.
Janelle, do you want to give us a couple of guidelines for prevention that all of our listeners can follow along with?
Yes. So stay away from people who have been sick. Make sure you wash your hands with soap and water, but you need to do it for at least 20 seconds. So one of the things I was always taught is you should sing happy birthday or the ABC song.
Yeah.
That typically is about 20 seconds. And if you don't have that option, use hand sanitizer. But it needs to contain at least 60% alcohol.
Oh.
And make sure you are not touching your eyes, your nose, or your mouth.
As Chris touches his nose.
And if you think you might be sick, please get checked immediately. Also, avoid unnecessary travel, large functions.
Like conferences.
So, yes, like conferences or concerts or basketball games. We've seen where the NBA is debating whether to
Cancel basketball games.
basketball games for
And
fans.
this is serious.
Makes sense. Yeah.
So, and if possible, work from home. We are seeing that older adults and people who have severe underlying chronic medical conditions, it can be any age. It could be things like heart disease, lung disease, diabetes, that you are at a higher risk of developing more serious complications.
From
So
this
please,
virus.
yes, please consult your your physician and reach out to them to find out if there's other things that you can do to protect yourself. And if you are sick, you should wear a face mask when you're around other people. And you should definitely do this before going into a healthcare provider's office. And if you're not sick, you do not need to wear a face mask. I know people are scared right now, so we're seeing those face masks go off the shelf. But right now, we need to make sure that those face masks are available for caregivers.
And
also,
first responders.
yes, and first responders. And if you are taking care of somebody that is sick, wear a face mask. And then also clean and disinfect frequently, touch surfaces. So that could include tables, doorknobs, light switches, countertops, handles, desks, phones, and so on. Most common EPA, registered household disinfectants, will work.
Yeah, I think one of the things you mentioned before too would just be your keyboard and mouse. I mean, you touch those
Yes.
constantly, and I think just as a general rule, we should be cleaning those more than we do.
Yes.
And you don't realize how often people touch their face.
Yeah,
So since this has been going on, I've just noticed how often I actually will
Same
put my hands to my
here.
face or notice it with others. So you just have to
Yeah.
be cautious.
part of the reason we're doing this war room is to inform you guys about what questions we're getting, but also the ways in which we're managing this. So I think, first and foremost, people are just wanting additional information about the COVID-19 virus. There's a ton of misinformation and sort of fear-mongering out there about it, so it always helps when you have the facts. But also, what the proper response plan is. So, we're talking to multiple, state and local governments right now, as well as healthcare organizations, and it's all the exact same questions on the topics that we've been covering right now. And I think you guys hit on this a little bit before, is if you notice the people that have had the worst reactions and even most of the deaths from the coronavirus have been people over 70 with an immune system that has been compromised in some way. So for long-term care facilities, that they're made up mostly of people that fall into that category. So, I think most importantly, you want to make sure that you're not bringing germs into them. But then, of course, to look out for yourself, the germs that are present within that sort of, internal community, you want to make sure that you're not contracting it and taking it back out of there yourself. So all the things we mentioned before, as far as hand washing, masks, not touching your face, things of that nature, are all, I think, going to be essential to those types of things. Did you guys have anything to add to that?
Well, I do have a few more questions that I actually just pulled up an email from one of our states that had some questions initially while we were working with them. And one of them, do we get reports daily? Do we get the reports? How often do we get reports?
No, that's great. As a part of, that's a great question to address now too. So as a part of the best practices and sort of that workflow that I was talking about earlier, from, taking the call, from asking the questions to determine if it's COVID or 19 or not, referring them over to get tested if we think that it is. But we also are providing real-time reports, not only to the client, but to any of the state health organizations as well, so that they've got real-time data on the trends, on locations of where the virus is spreading, if they can start noticing patterns. And really, again, when you have that type of information, it really helps you to begin managing. I think you mentioned that New York has taken some extreme measures now, right?
Yeah, so this morning I was listening to the radio, and they said that they have actually put a quarantine zone in process.
Wow.
And brought in the National Guard.
Wow, that's scary.
So, I mean, obviously this is extremely important and something that we need to keep track of. And so getting reports as they come in is definitely something I think is important that the hotline has.
Yeah, absolutely.
So another question they asked us, how do we provide you with current new information and how long till it gets up?
Yep. So that's a great question too. So one thing that we typically do with our clients is a monthly, and this is just for anybody, any of our clients, we do typically a monthly check-in to make sure it's sort of a customer satisfaction thing to make sure that we're continuing to earn their business, that they're happy and that we're meeting all of their expectations. Given this situation and the hotlines that we're setting up, and because it's ever changing on a daily, even hourly basis, we, with some of our clients, have begun doing either daily or weekly check-ins based on the size of the organization and really what their needs are and how we're seeing the situation advance. So in those types of calls, we're looking at that day's trends, the additional reports that have been added that day, any locations or similarities we can see between the reported cases, and then even just maybe the cases that were reported that we've confirmed maybe weren't COVID, right? So at that point, we're trying to measure the people that are just sort of the fear factor of it, right? Like they feel a sniffle and immediately they're calling in because they're afraid that they've got it. It sort of gives you an insight into taking the temperature of your population and sort of what their fear level is.
Right, and
honestly.
if we need to make a change to our script or phone
That's
calls,
exactly
we can
right.
do that immediately, correct?
Yeah, on the fly.
Okay.
So changes to the intake process and the reporting that we're doing as well. Those are great questions.
So if they want to do this, how quickly can we get this set up for them?
That's a
'Cause
great question.
That's something they need now.
Yeah, absolutely. So we have the capacity and the resources here to set up a reporting hotline and get it fully in place within 48 hours. We've got one of the fastest setup times in the industry, and because we've been dealing with healthcare for so long and have already been taking in cases like this through our client populations, this is a really easy thing for us to ramp up on and begin providing great value. So if anybody out there listening in TV land has got a need in this area, please call us. We would love to consult with you on some best practices and how we can get this spun up for you guys immediately and begin helping you to control this epidemic or pandemic now, right?
Pandemic.
Yeah, absolutely.
And one thing to add, we can provide you with a toll-free number right now.
Yeah, immediately.
So you have it. You can start getting ready to promote it and get it out there to citizens, your organization, and so on.
And and we can do as much as needed. We can customize everything. If you want a website, however you want to make this go further, we absolutely can do that, right? We have customization and everything.
Yeah, for the ease of reporting, we've got web forms. If people decide they want to report that way rather than calling in, we can turn any phone number into a text message line so people can text in their concerns. There's really not a lot we can't offer there as far as intake methods to make sure that people have the maximum ability to report their concerns in, and so that, more importantly, again, that you get visibility into it.
And if you want to put a special message out there on the web reporting site, you can put that out there. You can have your own questions if there's specific ones that you want to ask. You're able to do that.
You know, that texting thing with having a shortness of breath, if you really have the coronavirus and that shortness of breath and having a hard time breathing, a text message is going to be a lot easier to make that report.
Good point. So just to kind of wrap this up, guys, I hope this was helpful information to you about sort of some background, the current state, and how we can help you get your coronavirus reporting hotline set up. Obviously, if you guys have any questions whatsoever, or if ComplianceLine can serve you, please don't hesitate to reach out to us. Again, I'm Chris Martin, and this is Janelle Case and Jess Tamris, and we hope to hear from you soon.